One of the things I think about when I think about the need for clinical leadership is sort of what I see on a day in and day out basis, and that's that. We've got a lot of really wonderful caregivers, very talented caregivers, trying to do the right thing, day in and day out. They're trying to take the best care of patients that can, and at times, what's really concerning to me is that we see people sort of bumping their heads against the wall in frustration because the system that they're functioning within is really not designed to allow them to provide the best care in the way that they want to provide it. So what we have is a workforce of clinicians that is struggling to do the right thing in the system the way it's currently designed. So with that said, what do we do about it? I think that the opportunity right now really is around clinical leadership and the opportunity to sort of take a step back and say, let's redesign the system. Currently the system that we have is hurting patients, it's not providing the optimal outcomes, it's expensive, and it's burning out our workforce. So what can we do if we had to design a system that actually energized and nourished our workforce, that was able to provide not just better outcomes, but the best possible outcomes for patients in a consistent fashion and safe fashion? What would that look like? So the value of clinical leaders in this regard is that they're closest to where the work is done, and if you talk to them and you get to the front lines, you really understand that they see a lot of sort of opportunities for improvement and a lot of the waste that goes on in the system. If you want to know where things are broken, you can ask them and they'll tell you. If we can provide them with the skills to sort of, in the framework to sort of look at these problems and envision changes and provide them with the skills to actually transform a system to work in a better way, I've seen remarkable results. So physician leadership plays a very critical role in all of this too. When I think about just the affordability aspects of healthcare right now, there's a lot that's been going on in terms of efficiencies as it relates to staffing, as it relates to the traditional levers of fixed assets and managing your cost structure and just a purely operational mindset. Not to say that there is an improvement, still opportunities for improvement there, but I think the thing that we have to realize is the thing that we haven't tackled is there's a lot of waste in terms of variation in terms of how we provide care to patients, and that if we can actually get our arms around that and ensure that of the 10 things that are evidence-based that these patients should be getting for this particular condition, that they're actually getting those things, and that there's not sort of waste in the process that adds excess cost to the system, we can take that and we can reinvest it back into the care and get it back close to where patients really need it. So the only people that can do that are clinical leaders, and physician leaders in particular have the potential to actually see those opportunities. And the role of leadership development in all of that is sort of translating a vision or possibility into making something real that makes a real tangible impact.
Great. Can meaningful change take place without physician leaders involved?
I don't think so. I think that there's a lot of change that I think will be limited if we don't have fully engaged, visionary physician leaders. So there's a few examples of this. In order to get meaningful change, you need to have physician leaders at the table, mainly because it's not only in terms of helping to expand the scope of and envision what's really possible in terms of creative solutions. I think it's also because in order to enact a lot of those solutions, to make these visions reality, it's going to involve physician to physician conversation. So as an individual doc, I might think that I've got the best idea in the world, and I might assume wrongly that all of my colleagues think the same thing. That's not the case. I mean, sometimes we all want to do the right thing, but we have different ways of going about it. And so the key is, shifting the the ownership of the issues, the problems to solve, to a group of physicians that are able to actually work through that and come to a collective solution that actually can make a meaningful difference. So I think if you try to solve problems without physicians involved or without physicians leading it, you're going to get stuck in the sense that the ownership, the implementation, the accountability for the solution is not going to be there.
Can you comment on the response that you see from your physician leaders to the PLI approach?
So my physician leaders are thrilled to be here. They're I think initially when we started to talk about the ideas for change in the system, one of the first things that came up among the group was, you know what, we've got great ideas and we know it's the right thing to do, and we don't know necessarily the right way to go about it or have the tools or skills to do that. So one of the things out of the gate was for these folks to say that we really see the need for physician leadership. We want to be a part of this, and we want to develop our skills and capacity to lead this change. So being here, they've been excited. This has been a number of months in the planning, and the engagement, the creativity, the aha moments, the ability to challenge one another and to see new perspectives that they hadn't envisioned before. Just observing that, and as the group goes through that process, is really a rewarding thing. It's fantastic.
Great. Do you envision that as a part of the Leadership Institute, where they're going to receive coaching and somebody working with them throughout that process will be valuable?
Absolutely. So I think that coaching is a critical component of the program that I think really will ensure not just success as it relates to the program, but I think will help a lot of these physician leaders navigate some of the transitions that they face, being both clinicians and physician leaders, a transition that's difficult for a lot of people to navigate. So I think coaching is critical in the sense that it's taking the conceptual framework, it's taking the project, and it's actually taking the individual aspirations and providing a space to work, one-on-one with a coach to actually dig a little bit deeper about stretching the realm of what's possible, to sort of share some of the vulnerable aspects of, look, I'm trying to achieve change in a particular area and I'm falling on my face. Having somebody to work through that with, I think, is going to be important. And then I think finally, the assistance in working one-on-one with a coach just to help strategize and be a thinking partner through the whole process of how do I get success, how do I get unstuck, is invaluable.
Mm-hmm. How important to CHI do you view the projects that they're going to be working on that are projects that CHI has identified as important to the organization?
So the projects that the group are going to be working on are vital importance to Catholic health initiatives. We are in the process of transforming our organization to one that has the ability not only to thrive in the current environment, but also to evolve to a place where we can manage populations effectively. So the projects that the group are going to be working on are really designed to provide them with the capabilities to lead improvement that results in reduced variation in cost and in quality. And reducing that variation is actually necessary for our success.